Good afternoon, everybody. My name is Bianca Gonzalez, and I'm the Bullying Prevention Program Coordinator with the Riverside Medical Clinic Charitable Foundation. Welcome to our Take 30 webinar. Before I go ahead and introduce our speaker for today, I want to just go ahead and thank our wonderful sponsors, the Riverside Medical Clinic and United Way of the Inland Valleys. We truly appreciate your support. And just a couple of things that I do want to go over. If anybody has any questions or comments, please feel free to leave them on the chat box on your right-hand side. Any questions and comments will be answered towards the end of the webinar by our presenter today. So without further ado, I want to present Ms. Rebecca Antillon. Rebecca Antillon has worked with the Riverside University Health System, Public Health, for over 17 years. She is currently the coordinator of the Teen Suicide Awareness and Prevention Program and is a certified trainer in various gatekeeper trainings. She works with multiple school districts throughout Riverside County, training staff, students, and parents on the warning signs of suicide and how to engage and support a young person in crisis. I will go ahead and give it away to Rebecca Antillon.
Oh, thank you very much, Bianca. And I want to thank everyone for joining us this afternoon. So the presentation that I'm going to be giving is called Know the Signs, and it follows along with a website, which is called suicideispreventable.org. So I'm just going to kind of introduce you to the concepts that are given in the website, and we really talk more about how to identify warning signs of suicide, how to engage with somebody that might be in crisis, and then also resources that could be available to help a person that might be having thoughts of suicide. And so those are the things that we're going to cover today, and it's probably going to go very quickly. So I do encourage all of you after today to take a look at the website suicideispreventable.org, go at your own pace in reviewing the information. I'm just really here to give you more of an introduction to this and hopefully answer any questions that you might have. So we are going to get started, and let's see here. So the first step that we're going to really cover is knowing the signs. And in the presentation that I'm giving you, the signs that we're going to cover are basically more common for our youth, although it can be signs that you may see in anybody that's having thoughts of suicide. And so we just really want to give you an idea of what you could possibly look for or pick up on. And hopefully this will help you in kind of steering conversation if you're concerned with somebody. So kind of getting into this, the way this is put together is they show signs as they go from the severe to least severe to more severe. And so we're going to kind of start off with maybe those signs that you wouldn't really think would be, we would consider to be warning signs, but we'll talk a little bit about them. And so the first one that we'd want to look at really is giving away belongings. So somebody who might be thinking of suicide may be finding ways to tell us in a nonverbal way. And for some individuals, that may be giving away things that they care about or cherish. So the example that's given here is somebody was giving away their necklace. They also were giving away things that maybe have value to them. And again, especially for our young people, if they're thinking or contemplating suicide, it may be challenging for them to verbalize that. And so they may, this may be a way for them to put things in place before they act on their thoughts of suicide. And so that's why we look at giving away belongings as a potential warning sign that we'd want to be concerned, or maybe we would want to ask about. Sudden mood changes. When we talk about sudden mood changes, it can be challenging, especially when we're thinking about youth. But when we talk about sudden mood changes, we're talking about changes in mood that we've noticed for at least 2 or more days. Now, that's something that, especially with our young people, it can be hard. I know I have a 14-year-old daughter, and she has moodiness. But we're not talking about the typical adolescent type behaviors. What we're really looking at, if mood changes are occurring and it's lasting for 2 or more days, then you would maybe want to engage in a little bit of conversation and find out what's going on. Loss of interest in things. Sometimes people who are experiencing depression, who are worried, having worries in their life, who maybe are in crisis, sometimes they just lose interest in things they once enjoyed doing. Again, for our kids, it's a little different. It's normal for kids to maybe change direction and focus on other things. And so what we really look at here is if we notice a loss of interest in activities they once enjoyed, and they're not replacing those things with other types of activities, then that's a sign that we would want to look out for and maybe engage in some additional conversation with them. Physical pain. They frequently complain about physical symptoms, often related to emotions. We've noticed again, especially with our young people, it's very challenging for them to express emotional stress that they may be dealing with. And so they're holding that stress in, and sometimes it will manifest into physical symptoms. So often when people are experiencing that, and they may talk about having headaches or stomach aches, but they can't associate it to any one thing. I'll give you an example. We've had youth that have come to talk and share stories with us, and they've talked about how they were feeling so overwhelmed with life and so stressed, and they were starting to feel physical symptoms, but they couldn't really attach it to, they weren't just getting over a cold, or they didn't have the flu. And so when you hear somebody talking about physical symptoms or physical pain, and they can't contribute it to one ailment, then we may have to consider that it could be emotional distress that they're going through. And so it would be a good opportunity to engage in conversation with them. The next one is a neglect of personal appearance. They have an unusual neglect of their personal appearance or lack of hygiene, and they just seem to stop caring about grooming or regular grooming. So individuals that might be experiencing signs of depression or feeling overwhelmed, this may be a sign that we see in them, is they just stop caring about their appearance or trying. Personality changes. They show a significant personality change. The example here is he was always so calm, he never had a temper. But after his girlfriend broke up with him, he was so angry and was easily irritated by everyone. I never knew what would trigger him. And so what I want to point out in this here is there is also a situation where his girlfriend broke up with him. And so when we may see certain signs in an individual that seems different in their typical behavior, or we may see signs or see behaviors that concern us, if we can also attach life situations that are going on with that person, then that's something that we want to consider maybe engaging in conversation and asking about suicide. So, we know life stressors, life changes. I mean, it could be divorce, it could be the death in a family. If it's a young person, maybe stressors in school or friendships, or we even know for young people, relationships can be really overwhelming and hard to navigate. And these could all be stressors that if we compare it with behaviors or signs that we're seeing in somebody, that gives us a better indication that we may want to engage in conversation and maybe ask if they're having thoughts of suicide. The next, the next sign that they go through is substance abuse. They are drinking alcohol or using other drugs. A lot of times individuals that engage in substance abuse, and I say substance abuse because that's different than engaging in the use of maybe a drink here or there, for adults, that can be typical, and it it doesn't have to be problematic, but especially for our young people, if they're engaging in any type of use or alcohol or drugs, then we have to consider that they're doing something to try and mask some emotional distress that they might be feeling. So when we talk about substance abuse, we really need to step in if it's a young person and really ask what's going on and find out what's happening in their life, that they may look at the use of alcohol or drugs as a way to cope. And so that's why we list it as a potential warning sign. Withdrawals, withdrawing from friends or family. It's typical for our young people to want to venture out and maybe do more with friends and find some independence from family and maybe pull away a little bit from family. But if they're pulling away from both family and friends, that could be another indication that something's going on, because then that's not typical behavior. Or if they're pulling away to such an extent that they're not engaging with you even on a daily basis at least once, that's something to consider as well. They isolate themselves. We want to watch out for that. Whether it's a teen or an adult, anybody that's withdrawing from their support system or from those individuals that are close to them, we really want to engage in conversation and make it a point to try and talk with them and find out what's going on. The next one is changes in sleep. And so this one here, the example they give is, my daughter was so athletic and energetic, but suddenly she wanted to sleep all the time. And so when we talk about this in relation to potential warning signs, what we're really looking again is they could be going through some type of emotional distress that's impacting their ability to sleep, or maybe they're just wanting to sleep all the time. Somebody that's going through this or maybe showing signs of depression and it's impacting their ability to sleep, then we really want to, again, engage in conversation and find out what's happening. We also have reckless behavior. We see this more with our young people, but we can see this as a potential sign even with adults. If they are engaging in behaviors or activities that could be harmful to themselves or others. Again, with our young people, they are challenged in verbalizing what's going on with them. And many times they may not feel comfortable in sharing that they're even having these thoughts of suicide. There could be shame associated with engaging in that kind of discussion with somebody. And it's not just our young people that could feel that way, but even adults can feel that way. And so they may act out as a way to hopefully gain somebody's attention. And so they may be engaging in behavior that could be harmful to themselves or others. And we definitely want to step in and inquire and engage in conversation and find out what's happening with them. And what we have here these are what we call the more critical signs. So if we have somebody that's talking about death or suicide, is talking about death or suicide while they're under the influence of alcohol or drugs, or they're seeking a method, or they're threatening to harm themselves. These are all critical warning signs. And on the website, the strategy that we take for this is that we tell individuals to call in emergency support right away if somebody is doing or engaging in any of these behaviors. You want to call 911 if it's life-threatening. You never want to put yourself in danger. So if somebody does have a method for harming themselves, and it's a method that could be a danger to others, such as a weapon, then we don't ever encourage anybody or ask anybody to intervene. What you would do is just call 911 immediately, let them know as much information as possible, and that so they can step in, and we let professionals come in and engage with the person. But the important thing here is that if you ever see any of these signs, what we're asking is that you just act immediately. So I did cover the warning signs pretty fast because we don't have much time. So what I am going to suggest is that you just take some time to really maneuver through the website. Like I said, this is just an introduction for you. We are going to also talk a little bit about finding the words, because this is important and this can be often challenging for people. Engaging in conversation about suicide is not a comfortable thing to do, not for anyone. So finding the words, it's really important that we take a moment to think about how are we going to engage in conversation. And the website gives us a really nice step-by-step process on how we can do this. So the first step is starting the conversation. And if we're going to start the conversation with somebody about suicide, we need to have resources available. So it's important for us to take time before we initiate conversation to find out what resources are available. And on the website, there is a reach out section, and we'll cover it a little in a few minutes here, but you can look at some resources that are national, state, and even local resources. And so just kind of have that information available before you enter into the conversation. The next thing you want to do is you want to talk to the person and let them know the things that you've noticed, the changes in their behavior. Notice that you've seen them, if they've been isolating themselves. Notice that, hey, I've seen that you haven't been engaging with us lately. You haven't come to talk lately like you normally do. I haven't heard from you in a while. I'm really just kind of worried about you. And so just kind of pointing out some of those warning signs it's not you calling that person out for their behavior. What you're doing is you're letting that person know that you have picked up on all those clues that they're putting out there. You have noticed the changes and that you're concerned enough about them to ask. And so once we've kind of engaged and initiated the conversation by pointing out some of the changes in their behavior, then we need to ask about suicide. So we would ask, sometimes when people are going through things, or sometimes when people are feeling this way, they may be thinking about suicide. Are you thinking about suicide? So we really encourage you to be really direct in asking. And we want to reassure you that talking about suicide does not put the idea in someone's head. We are not us as human beings, we're not that easily influenced. So usually if somebody is thinking about suicide, being very direct with them and being the person to initiate that conversation can really help alleviate some anxiety they may have in telling somebody that they've been thinking about suicide. I had a young person I was giving a presentation to not too long ago. I was at a community event giving a presentation on suicide. And I didn't know this young person, but at the end of the presentation, they came to me and said, you're the first person I've heard talk out loud about suicide. And the person then started to share information about how they had been feeling overwhelmed and had been thinking about suicide. And so that was a real strong indication that just being open and being willing to engage in these kinds of conversations can ultimately save a person's life. So we can't shy away from asking directly about suicide. We want to do that. We want to do that for the person that we're concerned about, because they may need us to be the one to ask first and to initiate the conversation first. So the other thing we want to consider is, you want to say something. If you're uncomfortable with saying the word suicide, we can be direct in other ways. You can say, are you thinking of ending your life? Have you been thinking about killing yourself? So those are other types of ways that we can engage in conversation, ask directly about suicide. That doesn't have to necessarily say the word suicide if that's not comfortable for us. So the next thing we want to do is we want to listen, express concern, and reassure them. So just taking a moment to listen to somebody after they have shared that, yes, they've been having thoughts of suicide. This is an opportunity to just kind of let them vent or let them share what's brought them to that place. And through that process, it can even help to de-escalate for them, and maybe they can gain some clarity. I've had many individuals, share that after they've just kind of been given an opportunity to talk through what has been so overwhelming to them, they've realized that maybe there are some options, and they stopped looking at suicide as an option and started looking at maybe there were some other things that they could do to help the situation that they were in at that moment. So, just giving them an opportunity to list to share what's going on can go a long way in getting that person to a place where they're willing to accept help and move forward to in saving their life. So we just want to express concern after we've taken a moment to listen, let them know that we're concerned about them and that we really want to be there to help them. And so the way we're going to do that is we're going to help create a safety plan with them. And so we just cover some really basic things that we just want to make sure that we want them to be aware of, or that we want to be aware of to help keep them safe. So we want to know if they have a plan, and if they do, what that plan is. And so we want to remove that plan or take that plan, disable the plan from them. So if they have weapons or prescription medication in the home and they've talked about utilizing those as ways of harming themselves, then we need to remove that until they are in a better situation and that's not a threat to them anymore. If there is a situation, though, where they're talking about having a means and they have that means in their possession, such as a weapon, then again, I just want to stress to you that we never, ever ask anyone to put themselves in danger. If that's the situation, then you immediately call 911 and bring in professional assistance to help disable the plan. We also want to get them thinking about who's in their support system. So who can they call if their thoughts or their feelings become overwhelming to them? Obviously, you would be a person that would be considered as part of their support system, but we have to get them thinking about other people that they can bring in, or other supports that they might already have in place. If they are seeing a therapist or they have a counselor that they've spoken to, maybe we can encourage them to get connected with that person. Maybe there's other family members or friends they want to bring in that can help them as well. So we really just want to engage them in thinking more about who else they can connect with and talk with if they in order to gain that additional support so that they can get to a better place. Then we want to ask that they make a promise not to drink or use any type of drugs until they can get some additional support, whether it be talking to a counselor, engaging with a therapist, or even just calling a helpline. We know that alcohol or drugs can just escalate and feelings of hopelessness. And so we really want them to stay away from that just for a short amount of time until they can connect with somebody to help them further. Then we want to ask for a verbal commitment from them that they aren't going to act on their thoughts of suicide until they have at least had the opportunity to meet with a professional. And so we say this is short-term commitments because somebody who's in a crisis situation who is having thoughts of suicide may not be able to commit to these long-term plans or long-term commitments. So in this situation, all we're asking for is just short-term commitment to not engage in any harmful behaviors until they can meet with a professional and hopefully gain some additional support and get them on a path to feeling better and recovering from their thoughts of suicide. Then we want to just remind them that we know it's awkward, it's uncomfortable, so let them know that you understand that asking for help can be hard and can be a little overwhelming. There is the crisis line, there is the helpline. The National Suicide Prevention Lifeline is always available. And if they can't commit to staying safe, that's okay too. But just understand then that's when we have to call in 911 or we have to take somebody to the nearest emergency room, because we never want to leave the person alone if they can't commit to staying safe. We want to do whatever we can to help them through their moment of crisis. The website also gives us some tips on what not to say. So we really want to make sure we think about how we ask the question about suicide. We want to make sure we ask in a way that's non-judgmental. So they give the example of, "You're not thinking about suicide, are you?" So when we phrase the question in that way, the response we're really looking for is a no response from the person. We want them to say no. We're not looking for an honest response. So really think about how you ask. Make sure it's in such a way that's open and that allows the person to answer honestly and without and ask the question in a way that's phrased without judgment. Sometimes, especially if you're talking with somebody that you're very close with, that you love, care about, it can be overwhelming. And some individuals, when they're overwhelmed, they may find themselves getting frustrated. If you find yourself getting frustrated, let the person know. It's okay to be honest with them and say, this is scary for me. I'm finding myself a little overwhelmed. I need to maybe take a step back, take a step, get a drink of water, take a deep breath, and then move forward. It's okay. It's understandable if we get overwhelmed and maybe lash out in frustration, as long as we catch ourselves and we move to just thinking about how we can help the person without saying things that might be more harmful. So it's important that we catch ourselves and we move on in a more productive way. We never want to promise secrecy in situations like this. So we never want to tell somebody that we promise we won't tell anyone about their thoughts of suicide, because that's not realistic. We have to engage other people to get this person the support that they need. So what we can promise them is we can always promise discretion. And what we mean by that is tell them, I can't promise secrecy, but I can promise you I'm only going to bring in the people that need to know and that can help you at this moment. So we can always promise discretion, but we can never promise secrecy when we're dealing with suicide. And then the next section that we're just going to briefly go through is the reach out section. And this is where all in the suicideispreventable.org website, this is where they list all resources that are available to youth and families in crisis. And I just want to briefly point out there are some, California has the mental health movement called Each Mind Matters. There is lots of great resources for individuals that are dealing with mental illness and mental health disorders and maybe are looking for some support. There's also the Living Works a website. I believe it's Living Works Education. And if you're looking for additional training on how to engage with somebody who's having thoughts of suicide and maybe even learn intervention strategies, Living Works has some great programming that's available. And then there's also the Trevor Project that has crisis intervention and suicide prevention services, specifically for LGBTQ youth. So that's a really great resource as well. You can always go to the National Suicide Prevention Lifeline. The phone number is 1-800-273-8255. And there is a specific a line that you can press for individuals that are veterans. And there's also Spanish-speaking support for individuals that would need that as well. And then finally, there is here in Riverside County, we do have a helpline. That's a local helpline that's available to anyone. It's free, it's confidential. If you're looking for additional resources, there's the 211 line. So anywhere in Riverside County, if you call 211, you're connected to a local, to an individual that has access to thousands of resources, and you tell them what type of resource you're looking for, and they can provide you with some resource information. We also have the CARES line, which has information and referrals for Medi-Cal and Riverside County health plans. So if you're looking for actual direct services or mental health support, you can call the CARES line, and that's also a resource in gaining support for somebody that you're concerned about. And so that is it. Again, this information we went through very quickly, but I just want to thank you for your time, and I really want to encourage everyone to take a look at the website, suicideispreventable.org. It has lots of great information on there, and it will go in much more detail with you in terms of how to engage with somebody and how
Thank
to
you so much, Rebecca.
support somebody that might
So
be
we do have some time for a couple of questions. If you all, or not all of you, but if some of you want to leave some questions in the chat box, please feel free to do so. I do want to let everybody know that I do have a copy of the PowerPoint, so I am able to send that out to everybody that attended the webinar. So I did want to note that for all attendees. But in the meantime, I'm going to give some time for if anybody has any questions, but I did receive a couple of questions before the webinar, and I did want to ask you, Rebecca, if you knew what biological factors increase the risk for suicide.
Wow, so that's a really good question. So biological factors, I'm assuming if you're, what you mean by that is if there are factors that maybe put somebody at an increased risk for suicidal ideation. Definitely, I would say probably we'd have to look if there's somebody that has a family history of suicidal behaviors. So if there's somebody in your family that has had has acted on thoughts of suicide or has been who has died by suicide, that could put somebody at an increased risk. If somebody has a mental health disorder, or if there's a mental health disorder that runs in their family and they are receiving proper support, that could also put somebody at an increased
and then
risk.
I have a question from Christy Granillo, and she would like to know if parents are notified immediately if a minor has suicidal ideation or thoughts.
So that's a good question, Christy. What I can share with you in working with schools and working with school districts, what I understand the process to be is in most cases, if a young person is at school and they are talking with a counselor or with an administrator on campus and they are sharing that they're having thoughts of suicide or they've had thoughts of suicide, and the administrator or the counselor on site goes through a risk assessment with that young person. If it's deemed that the young person cannot stay safe or can't keep themselves safe, then they call in the school resource officer or law enforcement, and then that child is placed on a 5150 hold. And the parents are not notified until, from my understanding, the parents are not notified until the child is taken to an emergency treatment center, where they're placed on anywhere from a 24 to a 72-hour hold. And once the child is put in that situation, then the parents are notified at that point, but they're not notified prior to being put on a 5150
She actually added
hold.
in one more thing.
She
She asks in the situation that the parent may be the source or the relationship is strained.
Yeah, so that is realistically the reason why many school districts have that in their protocols, not to engage or inform parents until after the young person is placed in an emergency facility, because we do know that there are cases where young people, their source of stress or their source of trauma or whatever it is. It could be
Well,
due to
thank
the
you so
relationship
much,
with
Rebecca.
parents or
That is
with
the end of our
caregivers.
questions. I want to thank everybody for attending our Take 30 webinar today. And like I said, I will make sure to send out the PowerPoint to all attendees that registered. So thank you all. And thank you again, Rebecca. We were happy to have you. Bye-bye.
Thank you so much. Bye-bye.